This is Talk to Kenny, sharing knowledge, liberating minds. Hello there. Thank you so much for joining me on another edition of your number one educative online broadcast, Talk to Kenny. Our topic of today is asthma. We'll be talking in depth about what asthma is, the causes, the symptoms, the preventive measures, and how to treat asthma. And in the studio with me today is a registered nurse with over a decade of experience. She also specializes in entrepreneurial healthcare, and she's responsible for several medical outreach nationwide, which eventually led to the establishment of an eye clinic. And in turn, this has helped thousands of people in early detection of any eye defect and also the possible medical treatment to it. She is an astute learner, an educator, an healthcare practitioner, and also she is a KD distributor. She is no other person than our very own Dr. Fanny Tope Omolara. Welcome to the studio, ma.
Welcome, sir.
Welcome. Can you introduce yourself to the audience?
I think you have tried. My name is Mrs. Fanny Tope Omolara. As you said, I'm a nurse, a lecturer, an educator, a health practitioner for certificates. By the grace of God, a KD consultant.
Wow. All right, ma'am. You are welcome to Talk to Keddy one more time.
Thank you.
Yeah. In case you are joining us for the first time, this is Talk to Keddy, your number one educative online broadcast, brought to you from the stable of Keddy Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and equipment nationwide. Welcome on board and stay tuned. In today's broadcast, we'll be discussing a crucial health issue that has the capacity to plague both men and women. Are you with me? All right, that is asthma. Asthma is a long-term respiratory condition where the airway becomes inflamed and constricted, leading to breathing difficulties and other symptoms. According to experts, asthma has capacity to affect both male and female, but its prevalence changes according to age and gender. In children, asthma is thought to be rampant in boys, while as for adults, the reverse is the case. Asthma is rampant amongst women. And this shift can be linked to hormonal influences, differences in the immune system, and other variations in airway sizes. These and many more are what we're going to be discussing today in today's broadcast. So don't forget, you can be part of this conversation in the comment section. Peradventure, you have treated someone who has suffered from asthma. You have somebody that is living with asthma currently. Feel free to share your opinions with us. We'd like to hear from you. How did you treat this? How did you manage this ailment for that particular person or those patients? We'd like to hear from you. And by adventure, you have questions whatsoever. Any of your questions, either pertaining to this topic or any other one, feel free to share your questions with us in the comment section. And I can assure you that before the end of this broadcast, we will do justice to them all. All right, over to Dr. Fanny Tope Omolara as she takes us through asthma. Doctor, are you ready, ma'am?
Of course.
You are very much ready. All right. So without further ado, I'd like to have Doctor. In your clinical experience and everything, the things you have acquired, what is asthma? How does it affect the respiratory system, and what are the possible common symptoms that is associated with asthma?
Thank you very much.
Yes, ma'am.
What is asthma?
Yeah.
Asthma is a chronic inflammatory lung disease.
Yeah.
Chronic inflammatory lung disease that is characterized by airway hypersensitivity and airway hyperresponsiveness and reversible obstructive airway obstruction. Let me explain it one by one. What is chronic? Chronic is something that happens for a long time. What is inflammation or inflammatory disease? Inflammation is body's natural response to fight against virus, bacteria, foreign, whatever in the body. It is natural and it comes and goes naturally. Because if there is no inflammation, wound will not heal. Inflammation happens in some metabolism cases and some other things. But when in cases like asthma, or in some cases, the inflammatory process becomes excessive. And that's why I say it is an chronic inflammatory lung diseases that is hypersensitive. The airway becomes too hypersensitive. Then there's something I want to say about the airway, which we'll be talking about. Normally human being inhale and we exhale. Yes. During the process of bringing in oxygen, air passes through the nose into the pharynx, to the sinuses, then to the pharynx, from the pharynx to the bronchial, and from the bronchial to the bronchioles, from bronchioles to the alveoli. Now, the last smallest area, which is the bronchioles and the alveoli, are much more affected. In somebody that have asthma, when you are going on the well, somebody is sweeping, you inhale dust. Somebody use a very strong perfume, you inhale it. You have a pet in your house like cats and dogs. There's a period they share their force, you inhale it. A normal person inhales it and reacts just normal. But somebody is asthmatic, we now overreact to it by, because the inflammation is already there before, but now reacting in producing mucus that will block the alveoli. And that means the person will be breathless, the person will be breathing fast. Let's say somebody has 1,000 alveoli and 500 of it are already blocked with. What happened is that the person will not be able to breathe. Let me now finish the last one, which is reversible airway obstruction. In asthma, whether you use some drugs or not, it is reversible, because once the stimuli goes, the airway opens, and when it's open, the person becomes normal. And that's why when you see some asthmatic patient, even when they're telling you, a man or a woman, that although I was asthmatic, I've not been having the attack because it has not been triggered. You get it now? So, but for somebody, it is reversible in asthma, and this differentiates it from other chronic obstructive diseases like chronic bronchitis. So chronic bronchitis is not reversible, but in asthma it is reversible. Now you talk about the symptoms. Okay, we'll be explaining as we go. But what I'll tell you, when patient has an asthma, they present with cough that worsens at night, just because the weather at night is always very cold. Number two, they present with wheezing cough. Wheezing cough is somebody coughing. You understand? You'll be hearing the wheezing sound under is a classical symptom. You see breathlessness, the person cannot breathe. The person will not be able to talk very well. You see the person will not be able to finish a sentence. Then you see the person, this one is for a trained eye, the person is cyanotic, that is not bringing enough oxygen. The person is not really, you see the person is not comfortable. So as we continue, we'll talk more about the symptoms.
All right. Okay, doctor. So with this now, what could be the common causes of asthma? Could they be afflicted with any environmental factors like pollution or allergies, or are there genetic factors that is associated with the cause of asthma?
Yes, thank you very much. The cause of asthma is unknown, but it can be traced to acquired or hereditary. So, like you said, genetic. In the hereditary is very close to the allergic. We call it allergic. But hereditary, it runs in the family. You see the father have it, the mother, then the sister. You understand? So when you now ask, you see that it runs in the family. Now sometimes it starts from younger age, from like year 2 to 6. But at that time, we don't call it asthma. It's called bronchiolitis. It's within that 2 years to 6 years. You see the presentation too is like, you see that child having something like redness of the eye, itching of the eye, itching of the nose, discharging, running nose, coming to worsen at night. There's something, dermatitis like eczema, rashes. Sometimes, it's still, at that stage, you cannot say it's asthma, but in future, may or may not develop asthma.
That's if possibly treated.
That the child may continue with that one and may not still have asthma, but may have asthma too. I'm talking within 2 years to 6 years. When they get to 6 years, the diagnosis will be done with, I told you, chronic inflammatory disease that is reversible with bronchodilators. In the clinic, what they use is bronchodilators. So when they use bronchodilator and it stops, they know this is asthma. But like I tell you, the other one, chronic obstructive disease, will not stop with bronchodilators.
Okay. All right. Okay. Wow. So, Mark, having known all these causes now, what are the roles of diet and nutrition? Do they play a major role in managing asthma? The roles of diet and nutrition, and how can people living with asthma manage their condition? That's like a 2-in-1 question.
Okay. When we talk about diet and nutrition, yes. Like there are some diets that can trigger asthma.
Exactly.
So it depends on that individual. When you talk about allergy and people react to something, is individual. Some people react to palm oil, some people react to whatever. It now depends on that person to know what triggers it. Now, but basically, we say somebody should go on balanced diet. That is fiber, your protein, the carbohydrate, vitamin, minerals, and most especially fruits that contains ascorbic acid, vitamin C, something like that. So the citrus fruit, the oranges, and everything, we go a long way to help the person.
Okay. All right. Okay then. So with this now, are there any lifestyle changes that can help to minimize the occurrence of asthma? Are there lifestyle changes that can help to manage it or to reduce the frequency of this asthma attack in anyone? We've known the diet and the role of diet in this, but are there lifestyle changes that can help to manage it?
Thank you very much. Maybe I should look at it with the triggers from the
trigger
from
angle.
the
Exactly.
trigger.
Yes, yes.
Now let's look at the triggers. Like I said, you're passing on the road, you see somebody smoking. You are not the person smoking, but you're just
a secondary smoke automatically.
You take it. Then the person should avoid environment where maybe a woman is selling cigarette and the children are always there, inhaling the residual. Let me say, would I say passively? So it can cause it. Number two, dust.
Yes.
Exercise.
Okay.
You go to gym for children that play even in the school. Exercise can trigger asthma in the sense that after exercise, you have tendency to be breathing very fast. As you bring in all air that has particles. Then you look at a very strong perfume. Strong perfume too can trigger it. So they're called weather. Then let's look at dust. Then let's look at industrial waste, industrial smoke. Then that is the reason why you see people living in urban area have tendency to have asthma than people living in the rural area. In the rural area, what happens is that you have a very changing environment, trees and everything that gives you perfect fresh oxygen. Now don't let me mention Lagos.
Oh, we start mention Lagos.
No, that you're in Lagos, you are already in exhaust fire, films and everything there and there. So you look at it. So when we're not looking at lifestyle changes, definitely the person has to quit smoking.
If the person is a smoker, right?
If he's a smoker, even in all these lung diseases, you want progress, the person must stop smoking.
Okay.
That's number one. Number two, then the environment. You have to environment where there's pollution has to be, avoided. Then, I said, the acquired, I did not talk about the acquired too. The acquired causes too, like somebody taking certain drug, like non-steroidal drugs like aspirin, diclofenac, also can trigger it. So the person avoid it. So all those things should be avoided in such a way. Exercise should be mild, cold weather should be reduced. So maybe taking cold water should be avoided. Certain things that could trigger it should be avoided.
Okay. All right. Now, this is not part of our questions, but I'd like to ask this question.
Okay.
Take, for instance, this same Lagos I don't want to talk about.
Yes.
If there is someone who is an asthmatic patient, and the person happens to probably wants to transport himself or herself from one location to another, you cannot control the vehicle you'll be in. You cannot control the environment. But eventually, you are now some other person is in such a situation, and there is smoke. There are things that can trigger the occurrence of asthma. How can the person manage such situation?
If that person is an asthmatic patient. If the person is to avoid it, because they say prevention is better than cure. Okay. The person must look for how to just not do it. Is there any other way you're in Lagos, you're inside traffic?
Yes.
You have to know how to solve your
Okay.
Okay.
All right. Okay. So, moving on. Based on your clinical experience, and being a KD distributor, a consultant, a medical practitioner, like that. So, what are your most effective treatments? What are the most effective treatments available for managing asthma? What are the most effective treatments for managing asthma? Are there any differences between the quick relief mode of medication or the long-term control of medication for asthma? Is there any difference between these two? The first one is that what are the most effective treatments in managing asthma? And then the second part is that what is the difference?
Using the KD products.
Based on your own clinical experience.
Okay, clinical experience.
Yes.
In clinical experience, when you are talking about Western medicine, is that what you are trying to say?
Yes.
Using Western medicine, what they use is used historically, period before is aminophylline injection, but now not in use because of the side effect. But now what they use is bronchodilators like salbutamol, inhaler, they will line the patient. Now, what they do is, number one, I've told you it's an inflammatory disease that blocks the airway. They want to open the airway. Because of that, that's why they carry their inhaler anywhere they go. So you understand? Then they use non-steroidal anti-inflammatory to remove the inflammatory. So you understand the inflammatory process that is going there to stop it. So quick treatment is the inhaler. Long-term treatment is the anti-inflammatory drugs that they will give that person to take care of it. Now, coming to, say,
the difference. No, I said first that the difference between you've told us now the difference between the quick and the long-term mode of treating asthma, managing asthma. All right. So if we are now to talk about the using KD products now as a TCM practitioner. All right.
So I'm allergic cause takes care of it. So that's ratio for you. Now let's go to Cordyceps active, which is mainly for asthma. Cordyceps active we take care of asthma. It contains one ingredient called Cordyceps militaris. Cordyceps militaris has been used years in traditional Chinese medicine to take care of respiratory problems. And what it does is that it gives the lung, it helps the lung to perform its function very well. So with Cordyactive, with ratio and Vica is vitamin C, with calcium vitamin C, we all know it's an ascorbic acid and it's an immune booster.
Okay. All right. We've heard it all. So, what about the dosage now? how to the dosage for
Yes.
this, for the
You know-
Cody, for the Reshi, for the Cody Active and the Vicar. What is the dosage?
You know, the Reshi is 200 ml, 3 capsules twice daily, while Productive is 4 capsules twice daily. Our Vika is our effervescence tablet that you put in a cup of water.
Okay.
That one is very good.
All right, all right. So what are your success rates?
Good. You know, I think there was a case, that one is even, when you just give it, there was a girl, a child that was about 6 years, coughing with all these symptoms. We just give her, and the mother said, this child has been suffering for almost a year, but we just gave like today, the second day, or everything just disappeared.
Wow, wow,
And child,
wow, wow. Wow, you have heard it all from Dr. Fanny Tope Omolara. Now let me pause and take your questions. I have a question from Falsat on our ID page. She says, "Is asthma curable?"
yes. We will say, people believe that asthma is not curable because, like I said, somebody can be living with asthma for like 10, 15 years without having a trigger.
Yes.
Now, but if you are using our products like Reishi or the Active and Vika, you will see that it will cure it. Our product cures because it will give the lung, it allows the lung to do its function and take away the allergic and anti-inflammatory. So when person is taking our life essentials, the person will live a normal life, and that means it's cured.
All right. So doctor has told us now that Mrs. Falsat on the IG page, she said it is curable. All right, like I said, we read it all from the doctor, from Dr. Fanny Itope Omolara. And before we go, I will leave you with Dr. Cap Health tip for today. Dr. Cap says what? Stay one step ahead of asthma by knowing your asthma triggers, avoiding them, staying active, managing stress, and having a plan for every breath. I come again. Dr. Cap says what? Stay one step ahead of asthma by knowing your asthma trigger, avoiding these triggers, staying active, managing stress, and having a plan for every breath. Before we close, I still have a question which I would like to still read to us. We have a testimony here which we'd like to read to us. This is from one of our viewers online. That's a testimony from Omolaja McLean. That's on our Facebook page. Omolaja says, asthma client, okay, he has an asthma client who has been suffering from this ailment for over 10 years. And then he said he treated her with Kedi products, and in 90 days, wow, she was cured permanently. So this automatically answered the question of this other lady on our IGP that says, is asthma curable? With Kedi product, like doctor said, like Mr. Omolaja Makli said, asthma is curable with Kedi products. Just affiliate yourself, link yourself with any of our Kedi distributors nationwide, and they will help you with the right treatment in managing any asthma, any person living with asthma. On this note, we'll wrap up this edition of Talk to Kedi. I hope you have learned one thing or two. All right. Okay. And plus now, I can see your questions coming in. No problem. You can keep dropping them. I can assure you, if you're unable to attend to it now, by the end of this broadcast, doctor is still available and she's going to attend to every of our questions. So, doctor, this question says this: how can I treat prostate enlargement? This is quite different from asthma, but how can I treat prostate enlargement?
Yes, prostate enlargement is easy to treat too. You know, prostate enlargement is a condition that happens to men.
Yes.
Because of the enlargement, because of that time. But what to treat it? Number one, use Reishi, use Golden Alpha, use Vigor Essential, use Code Active, and use Revive. It's okay. But use those products over and over. Prostate will go.
All right. So doctor says we use all those products and prostate will go. And Lycovite. And in case you need to, don't worry, we'll link doctor up. We will tag her with our post, and then she will attend to your question personally. Like I said, on this note, we've come to the wrap of Talk to Kenny. But before I go, I would like to still remind us of our Dr. Cap tip. He says what? Stay one step ahead of asthma. How do you do that? By knowing your asthma trigger, by avoiding them, by staying active, managing stress, and having a plan for every breath. On this note, we wrap up this edition of Talk to Kedi. I hope you have learned something valuable in today's broadcast about the causes, the symptoms, the prevention of asthma. A special thanks to our wonderful guest, Dr. Fanny Tope Omolara, who took our time out of our busy schedule to inspire and to educate us today. Thank you so much, Doctor. Your last word as we close, man.
What I just want to withdraw before I say is that, as an asthmatic patient, believes that with Kedi products, asthma is curable. Just make sure you avoid the triggers. Make sure you take your Kedi products, and make sure you stay clear of anything that might cause anything asthmatic.
Thank you so much. In case you join this broadcast list, don't worry. The full video of this edition will be available in our Facebook page at Kedi Healthcare Industries, on our Instagram handle at Kedi Healthcare _official. It's going to be on our YouTube channel at Kedi Healthcare and our mobile application Kedi Care app. Feel free to watch and share with your loved ones, and don't forget.